Welcome to week 23 of the Mama Stay Fit Pregnancy Week by Week Update. In this video, we're going to share what you can expect is going on with your baby during week 23 of your pregnancy, what is going on with you, and then I'm going to be sharing how I am feeling during my pregnancy because I'm currently pregnant with baby number 4. If you're pregnant, be sure to comment below to let us know how you are feeling during your 23rd week of pregnancy because we would love to connect with you on this journey. Before we dive into what to expect during week 23 of pregnancy, I want to share that my book, Training for Two, is now available for pre-order. The book comes out in September of 2024, and it explains how to use prenatal fitness to help support your pregnancy as you prepare for birth. So head down to the show notes below to check out the book and pre-order it today. So Roxanne, what can we expect with baby during week 23 of pregnancy?
So baby is about the size of a romaine lettuce head, it's like the one that's long. That's the romaine lettuce, not like the little circle, because that would be going backwards. Romaine lettuce, the long one. But also, if you've ever watched Clueless, Cher's phone, that's also the size of a baby, if that is a reference.
This is the millennial week by week pregnancy update. We will do a Gen Z version in the future.
Yeah, I don't know what the equivalent of that would be for Gen Z, because that's not my generation. So what's happening with baby in week 22 is baby's skin is still wrinkled and transparent until they start to put on a little bit more fat. So if you still did like a little picture of baby inside, their skin would be a little bit transparent still and like kind of wrinkly, like a little like old person, until they put on some more fat. That's when they like plump up. Their cheeks might have a little bit of fat right now, so their cheeks might be a little bit more kissable, but the rest of their body is still wrinkly and see-through. Baby is continuing to do those practice breaths so that they can prepare their lungs and their body to be able to breathe outside of the womb. So it's still happening even at 22 weeks pregnant. They're breathing in that amniotic fluid and then breathing it out. But the blood vessels that are connected to the lungs are starting to increase in this 22nd week so that they, again, can breathe when they come out. But that's about it for baby. So for you, though, a little bit more exciting. Things are happening in the 23rd week. Depending on who you ask, week 23 is viability, which, depending on the hospital that you're going to deliver at, is the biggest key. Some hospitals prior to 23 weeks may not have any interventions that they can do if you went into labor to deliver your baby. But after 23 weeks, a lot of hospitals will have interventions that they can do to help babies survive outside of the womb if they're born early. A lot of hospitals, it's 24 weeks or 23 weeks, so asking that can be really beneficial if you have any risk factors of going into labor prematurely. But things that you might be noticing in week 23, maybe not you, but maybe you, is that there is that increase in vaginal discharge. So you might have just like a lot more discharge. It just starts around 22, 23 weeks. And you might notice that it has like a distinct odor. It's not bad, but it's definitely a different odor. And that could be because, one, it actually does have a change of odor, but also, two, your nose is like super powered during pregnancy. So you can smell things a lot more that other people might not be able to. But with that vaginal discharge, because it does increase, it could potentially change up that pH that we normally have within our vaginal flora. So being mindful of, is it changing any colors? Is it like, it's like really weird, like chunky, kind of like cottage cheese kind of consistency? Is it gray? Is it green? Those are not normal things that should happen to your vaginal discharge. Does it smell like fish? Those are all signs that there's some sort of infection going on. So some sort of vaginal infection is important to be treated during pregnancy because it could increase your likelihood of going into preterm labor because it could irritate that cervix in the uterus, which is not wanted. We want these babies to stay in for as long as they possibly can, not 23 weeks. So being mindful of that discharge, potentially calling your provider if you start noticing anything funky going on. Other things that you might notice is, one, that darkening of the nipples. Your baby, it's like the bullseye for your baby, and due to all of the hormones changes causing that darkening of the nipples. It will go back to normal, I promise, after you either baby is born, if you're formula feeding, or when you are done breastfeeding. They will return back to what they looked like prior to pregnancy. Again, I promise. You might also start noticing, because baby is bigger at 23 weeks. You might start noticing you're peeing all the time, because baby is pressing on that bladder and making the like volume that your bladder can hold a lot less. So you might pee just constantly.
I'm like, I
Constantly.
literally just went. Like,
Yeah.
I do not need to go again.
Nope, you do.
But I will say, even during pregnancy, you should only be waking up at most once a night to go pee. If you're waking up more than that, you might have some pelvic floor issues starting to develop, and working with a pelvic floor physical therapist could be super beneficial.
Yes. Yes. We will link our favorite pelvic floor PT, Haley Kava, down below. She does virtual if you need it. The last thing that you might start to notice around 23 weeks, and I find that this is more common in people who have had babies already and they breastfed, is that you might start noticing you're leaking milk already. So as soon as you start, as soon as pregnancy starts, your milk glands are starting to be like, we have to supply a baby, let's go. So the milk is there. It's just not coming out yet until the baby's born. And the type of milk that's there is the colostrum, which is that really thick, nutrient-dense milk. So it doesn't come out super easily, but sometimes during pregnancy, it can just leak on out. So if you do find that you're leaking fluid, you can always call your provider to make sure that it's it's not some sort of infection or anything else going on. But investing in some nipple pads could be beneficial unless you just want to have wet shirts. So my personal favorite nipple pads is just the disposable ones because the reusable ones never worked for me personally, but I'll link my favorite, Bamboo Bees. It's a fun name. So.
One common thing that I'll hear folks be concerned about if they are starting to leak colostrum is they're worried they're not going to have milk for their baby. They're going to run out before baby comes. Is that a concern at all?
No. So if it leaks out, you're they're just going to make more. So you're going to constantly have milk there. And this is similar even after baby's born. People are like, well, I'm empty. Baby drank all the milk. So my boobs are empty. There's no milk left. There's always some milk within your boobs. It's just some, it might just take a little bit more work to get some milk out than others, but there's always milk just waiting for the baby, especially that colostrum. But that's really it for you and baby. How are you feeling though, Gina?
So this past week, I did have a second trimester prenatal appointment with my home birth midwife. And now we have increased the frequency of our appointments to every 3 weeks. So previously, it was every 6 weeks during my first and pretty much the first half of my pregnancy. And now we've increased the frequencies to every 3 weeks. I decreased it, yeah. So previously in the first half of my pregnancy, it was about every 5 to 6 weeks that I was seeing her. And now that I am beyond the second half of my pregnancy, I'm seeing her about every 3 weeks. And then as we get closer to my due date, it'll be about once a week. So it is kind of cool to see that we've progressed in our appointment frequency. But baby girl is looking great. She was moving all around. I got my fundal check where she measured my belly. I'm growing right on track. We listened to baby's heartbeat. And what's really cool about community birth is that my kids get to be really involved with the appointments. When I do my hospital-based appointments, they still get to come to the appointment, but they're not quite as involved in it. So for the community-based birth, it's really cool because Sophia's helping to put the gel onto the Doppler, and she's helping to measure my belly. And so it's really cool to involve them in the preparation for birth and kind of normalize the experience for them. Because I know for me growing up and for you as well, there was no exposure to birth. We had really minimal exposure even to pregnancy, other than our mom being pregnant and seeing some other women pregnant in the neighborhood. But I definitely, the first birth that I went to was my own. And so it's not my vaginal birth of, not my actual of me being born, but the birth of my daughter was the first birth that I got to be a part of. And so it's cool for them to have this experience at a really young age in a way that's not scary for them either. Because I know that's always a concern for folks of well, I don't want my kids there because I don't want to traumatize them. None of them have felt traumatized by the birth, and they all are always really excited about it. And I think it's because they get to be involved throughout the pregnancy. Definitely feeling baby girl move a lot more. And I can almost feel body parts sometimes, when she sticks a foot up, I can feel her I'm that's a little foot or that's a knee or something, and I can see her from the outside moving now, aliens, which is wild. So it's and my little belly sticks out. The other day, I thought you poked me in the belly and it was her hitting me really hard.
Yeah, Gina looked at me like super angry, and I'm like, "What? I'm just driving. What's wrong with you?"
Like,
She's like,
did
why'd you poke me? I'm like, "What are you talking about? I did not poke you."
It felt like it was from the outside, but it was really interesting because that's like the first time I've ever felt the baby move in that way, to where it felt like it came from the outside, but she just like hit me so hard that it was like, I think she was responding to me sneezing, because I sneezed and it was like a jab.
Oh, yeah.
And she's like, see, startle for week 22. Here we go. It started.
She's responding to
It
sounds.
started. But she's moving all around. I can't quite tell like what her position is yet.
It's changing
I'm
constantly.
also not like super concerned whether she's like breech or head down at this point. At 28 weeks, I'll have another ultrasound with my provider, just because I do have some thyroid issues and they want to do like a check on baby's growth to see what the trend is looking like. And so at that time, I'll know whether she's breech or not. And if she's breech, then I'll be a little bit more deliberate with helping her get head down. But at this point, like, it's just kind of fun to try to figure out where she might be, but she's kind of all over. She's got a very volatile position that she's doing. I've also been incorporating a lot of like baths in the evening for myself to help me kind of relax, which is something that I did in prior pregnancies. And so my husband just got me this like bath pillow and like tray for Mother's Day, which I was really excited about. And then he keeps me well stocked on like anti-sore muscle like bath salts, which is really fun. So I've been doing my nightly baths, and yeah, otherwise feeling pretty good in my body. I was having a little bit of tailbone pain, so I was doing some myofascial release for that, doing a little bit more hip shifts to help release that tension, and then it went away pretty much right away. But yeah, physically feeling really good, sleeping a lot better this week. I don't feel quite as anxious anymore, which is wonderful. And yeah, pregnancy is progressing wonderfully. So hopefully you are also feeling pretty good in week 23 of your pregnancy. Maybe you have more discharge and darkening of nipples like me, which is maybe TMI, but during pregnancy, I feel like everything is just fair game for information. So let us know how you're feeling down in the comments below. We would love to connect with you on your journey. If you want more support throughout your pregnancy, check out our online prenatal fitness programs for daily workouts to help you stay strong throughout your pregnancy, pain-free, while also preparing you for birth, especially now that you're over halfway through your pregnancy. We can begin to incorporate a lot of birth preparation exercises to help prepare our body, to create more space within our pelvis for birth, release tension within the pelvic floor, and also to help support our baby's position. So you can check out our online prenatal fitness programs in addition to our childbirth education course.
So if you're looking for education on the birthing process and things to do during labor and kind of take away some of that mystery surrounding birth, then check out our online childbirth education course, because we discuss the science of birth as well as things that you can do with labor positions, labor comfort techniques, what your partner can do, what to expect during labor to kind of help prepare you for this very transformative time. We also have a little bit of postpartum in there as well. And you can check out any of our fitness programs and education courses on our website at mamastayfit.com and use code YouTube10 to get 10% off any of our courses, to include prenatal fitness, postpartum fitness, childbirth education, postpartum education, and our professional courses.